Good afternoon, everybody. Dr. Nick Coatsworth with today's national update on COVID-19. To the 24 hours to 12 noon today, we've had a total of 26,912 cases of COVID-19 in Australia, an increase of only 16 newly confirmed cases in the past 24 hours. New South Wales reported 4 new cases, 3 were overseas acquired and those people were in hotel quarantine, and 1 person had locally acquired COVID-19. It was a contact of a confirmed case. Queensland reported 1 new case of COVID-19 and that person was in hotel quarantine, and Victoria reported 11 new cases. 5 were locally acquired and contacts of a confirmed case, and 6 people's COVID-19 cases remain under investigation. Sadly, there were 2 new deaths overnight, both reported in Victoria, taking the total number of deaths from COVID-19 to 851. These are very pleasing results from Victoria overnight, and just a testimony to the immense effort of Victorians, both in rural and regional Victoria, particularly in Melbourne and its surrounds, those Australians who have been under a very restricted way of life for many weeks now. We would encourage Victorians to keep up the good work. There is still some way to go as your government and health services plan the roadmap out. It is, of course, pleasing when we see numbers so close to single digits, and the control that implies that we'll be able to keep COVID-19 under control. This light at the end of the tunnel is getting closer every day. We would, as we always do, ask for your patience. It is clear that the Victorian Public Health Unit, Professor Brett Sutton and his colleagues are taking these numbers into account as they plan further lifting of restrictions, but that patience, as always, is required. I wanted to also welcome the announcement of additional funding yesterday from the federal government to additional vaccine research in Australia at the University of Melbourne and the University of Sydney. We're investing in new technologies that are not yet under development in Australia, including the so-called mRNA technology, which is one of the United States-based candidate vaccines, and also another protein subunit vaccine. This is in addition to the over $1 billion investment in securing the Oxford vaccine that AstraZeneca is producing, and the letter of intent for production of the University of Queensland vaccine. So that sort of investment demonstrates the broad range of vaccine opportunities that Australia has at its disposal, and also a recognition that COVID-19 vaccine technology is going to need to continue to be developed, to continue to be improved throughout 2021 and beyond. Finally, just like to note, being a father of 3 myself, of course, that there are school holidays coming up, and around the rest of Australia, what that means, and regional Victoria, what that is going to mean is movement. And we know where there's movement, there's potential movement of COVID-19. So when you're out on your school holidays, make sure to remember the COVID-3, keep your distance, wash your hands, don't interact with others if you're unwell. Work out where the nearest COVID testing facility is for your particular holiday destination. And if you are sick on that day that you have to leave out of your major capital city, don't be the one that takes COVID-19 into regional communities in Australia. This is the new normal for us. We need to be exceptionally cautious. We need to get our lives back on track and enjoy the school holidays and do what Australians do in the spring school holidays. But we also need to do it particularly in a COVID-safe way. And I've got some in the room and some on the phone, so I'll just go to Tamsin to start with.
Yeah, obviously really exciting numbers coming out of Victoria at the moment, so it's a lot of hope. We're hearing that potentially some of the roadmap out will be sped up slightly with numbers coming down faster
Well, I think once again, where the numbers are encouraging, we still have to see what they do in the coming days. And certainly, if they continue down into single-digit territory, there's no doubt that will be provoking some thought on behalf of the Victorian government about the roadmap and when restrictions can be lifted. But I just wanted we do have to sound the note of caution here, and that is simply to say that the effort that Victorians have gone to so far, the incredible effort, could easily be undone. And we don't want that to happen. We want those decisions to be made with caution and safety in mind, and we're confident that the Victorian Public Health Unit is doing that, and we're providing advice as well through the AHPPC, and that the Victorian Public Health Unit has learnt so much and demonstrated improvements in the test, trace, isolate system that can give Victorians confidence of that extra firepower to be able to keep COVID-19 under control into next year. Well, the curfew was obviously designed with an intent in mind, and that was to restrict movement, which, as I said previously in the press conference, is part of the key way that COVID-19 spreads around. But as a public health measure, it was never debated or discussed within the AHPPC itself. And I'll just go to the phone and then I'll come back to the room. We might start with Matt.
Thank you for that. Just sort of building on what you were saying there about the hard work that Victorians have done could easily be undone, and you're warning there to members of the public who are going to be going on holidays during school holidays, travelling around a bit more. Are you concerned that we might be experiencing a bit of a lull at the moment, and as soon as people do start to travel around more and border restrictions are lifted between places like the ACT and Queensland and South Australia, that we could start to see clusters popping up again? And how fearful are you that there could be a sense of complacency and people might stop being as diligent as they have been in abiding by the rules that have been put in place?
Well, Matt, it's always going to be a balance, and we're clearly looking at numbers within 7 out of the 8 jurisdictions in Australia that do allow movement within states, from urban to regional areas, from Sydney down to the south coast, or indeed from Canberra to the south coast on school holidays. So there would be no point at the moment in restricting that sort of movement, because the numbers would simply not favour that as a proportionate response. But as I've said on more than one occasion, government, the HPPC, we can't do this on our own. So with those numbers being low, the obvious way to keep them low, but to keep our school holidays as close to as how they usually are, is to be as safe and COVID safe as possible, and that's going to be a responsibility for everybody, and will be a responsibility as we lift state borders as well. There's the opportunity now for residents of the ACT to go to South Australia. Don't get on that plane if you're unwell or at all feeling unwell. I think you can get your money back these days if you're crook and you don't go on the flight. You're doing the whole community a favour. So the licence to move is not a licence to move unsafely. We might go to Dana.
Thanks, Dr. Copeland. I've actually got 2 questions.
Sure.
The first one is about the Centre for Disease Control in the United States. The news overnight that they're saying airborne transmission is one of the main ways that COVID is spread. The AHPPC still says this is not a significant factor. I'm just wondering what the Americans are seeing that the infectious control expert group that advises you is not.
Thanks, Dana. So I have seen the Centre for Disease Control recommendations, and my reading of that, in fact, I think the wording is fairly clear that there's an increase in what we call aerosolisation and what they've suggested is the main mode of transmission is aerosol transmission, which is not quite airborne transmission in the purest sense of the word. But what does that mean for Australian national guidance? Basically, it has always been the case that Australian guidance, US guidance, European guidance has recognised that aerosols are produced by someone who has COVID-19 and that they can be inhaled by someone in close proximity and can be a form of transmission. So, as I'm speaking to people now in this press conference, about this far away at least, my speech is creating aerosols, and that aerosol can contain COVID-19. Whether it is the main mode of transmission or not is one of the issues that's currently under debate, and we've seen that there's been a shift from the Centre of Disease Control. I didn't see the references that were published on the website that they are using to base that decision. It is the position of other major organisations, our own Australian Health Protection Principal Committee, the European CDC, Public Health England, that the main mode of transmission is contact and droplet, and there's an increasing recognition that aerosols have a role. Now, what has Australia done about that? Well, during the Victorian second wave, the guidance on when to use N95 masks, which are the ones that protect you from transmission of airborne infectious disease, was expanded such that any patient within a hospital in Victoria at the moment, either suspected, the so-called SCOVID or COVID positive patients, are being treated by practitioners using an N95 mask. And that was an important step, recognising that role of aerosolisation. So that's a long answer, but I wanted to make sure that people were very clear that both the Infection Control Expert Group, the AHPPC, and federal and state health departments have all recognised the important and growing role of aerosols in the transmission of COVID-19. We continue to look at the evidence on a daily basis. You've got a second question, Dana.
Yes, thanks, Doctor. It's sort of a related question. So the latest AHPPC guidance on PPE states that SIT testing is the minimum standard for each occasion of use of a P2 or N95 mask, and that these are not protected if they don't fit properly. It also says that SIT testing of all healthcare workers who may need to use one of these masks will be difficult to accomplish due to limited supplies and range of types or sizes available. We've been told throughout this pandemic that the federal government has plenty of PPE. Now it turns out that we don't even have enough of the right masks for healthcare workers to access ones that fit them properly. What's the AHPPC advice to the government now on procurement and manufacturing of these masks to ensure that we do have adequate supplies?
Well, thanks, Dana. There's a number of elements to that question. The first one is I just need to point out that the minimum standard recommended under national guidance is in fact a fit check. And although it's challenging to explain in a press conference, I'm going to have a go because it's important. A fit check, otherwise known in the US as a seal check, when you put on an N95 mask, you make sure that it's adequately moulded around your face and that you can't feel obvious air leaks, either usually around the chin or up around the bridge of the nose. Easy for people with glasses, of course, because they'll fog up. Now, that is the minimum standard, and that is what anyone must do before they go into a room, someone with suspect COVID-19 in Victoria or COVID positive in Victoria at the moment. That has always been the minimum national standard. A fit test is different. A fit test works out what mask is best for you as an individual, noting that blokes with beards have to shave to wear an N95 mask. A fit test is something that's commonly performed by an infection control practitioner or an occupational medicine specialist, and actually uses a machine to determine how much leak is around a particular mask. So they're two different things, and the fit test was acknowledged and is acknowledged by European CDC, even US CDC, as a challenging policy tool to be able to roll out during a pandemic. In Australia, only South Australia had respiratory protection programs and fit testing prior to this pandemic, and now most jurisdictions, I understand, are considering fit testing programs, and Victoria announced theirs last week. We welcome that announcement. It's absolutely critical. To move to the second part of your question, in terms of supply of N95 masks and what is actually available on the market. The commercial market at the moment is robust for N95 masks. Whether you're an aged care provider, whether you're a state health service or a private hospital, you should be able to access a range of different N95 types. Some of those now are being produced in Australia, and prior to this pandemic, no N95 masks were produced in Australia. They are now produced in a range of different sizes and shapes, and that there are sufficient masks for fit testing programs to be undertaken by jurisdictions. So the last thing I'd say is that there are still, however, some very popular masks, such as some of the 3M series, that are still difficult to get on the national market. So the important thing for any fit testing program is range of masks and sizes of masks, and that they should be sufficiently commercially available in Australia at this point in time for employers to start respiratory protection programs. We'll just move. I think there's one more person on the call.
Yeah.
Yes, go ahead. Who's that? Paul.
Paul Osborne from AAP. Just wondering how concerned you are about the drop-off in testing rates. By my calculations, they're down about 30% over the last 3 weeks. And do you have any sort of theories on why it is actually happening, and whether it's in particular areas or particular demographics, or what the situation is there?
Well, Paul, I think we've all expressed concern about the decrease in testing rates. After all, the strategy is to detect people who have symptoms of COVID-19, and then you find your clusters, and the clusters can be sorted out before they turn into outbreaks. So we can only ask Australians with even the most minimal of symptoms, even if you think you've got hay fever, if you haven't had a COVID-19 check, you need to go and get tested. With regard to how public health units are actually targeting their testing, they're very aware of the need occasionally to do what we call asymptomatic testing, which has been discussed here before, where certain groups of people who are showing no symptoms at all but have been designated as close contacts of people with COVID-19 are encouraged to go and get tests. And that's an important tool as well. How do we lift testing rates? It's actually going to be a challenge, because we're moving into the months of the year where there's less respiratory virus. There have only been 36 deaths from influenza this year, and so it's challenging to get people to get out and get tested if they're not exhibiting symptoms. So I think, to sum up, I think there's going to be a natural decrease in the number of tests being done because of less respiratory symptoms, but just a big caution that just because we're entering the summer months, this will have no impact on our risk of COVID-19. We just saw the first and second waves in the Northern Hemisphere taking place during the summer months, and so we can't at all be complacent.
And just to follow up, is it possible that the drop in testing rates is actually skewing the number of positive cases that we're seeing?
As in, the number of drop in numbers might be masking a true number of undetected cases out there?
Correct.
Well, the percentage positivity has stayed the same, even in Victoria, which only, I think, recorded 7,000 tests. And those numbers are getting quite low now. So I don't think it's going to be masking a large number of undetected cases. What I do know, though, is that there's a big focus in the affected local government areas in Victoria, around Casey, where they've had the most recent cluster. And so a large number of those tests will be being conducted in those pop-up clinics, which should be some reassurance. And I'll just go back to the room, and if you like to stay on the line, I can offer you a couple more questions as well. Yeah, yes, Tamsin.
Great. If, as part of a contact tracing interview, someone was to reveal that they breached a public health order, should that person be fined, or are you worried that that would have a adverse impact on people?
Well, I think the principle is that we want to do things that are going to encourage people to be as open as possible. And so no matter what reason you may have for wanting to conceal information to a public health official, please don't do it, because it has some very widespread implications for your community. With regard to enforcement, that is a difficult question, and it needs to be one that I think is made on a case-by-case basis. And we've seen in Victoria clearly the decision was made with certain members of households not to fine them because they were forthcoming with information. And for that particular case, with that particular information available to the Victorian health authorities, that is the decision that they made. So I think you can expect to see some variability with that. But fundamentally that'll be a matter for the state who's enforcing the fine.
At the start of the pandemic, when the national restrictions came in, we heard that it was hard to tell which of the restrictions had been successful in suppressing the virus because they're coming all so quickly at the same time. Given that it was a more staggered approach in Victoria with the second wave, is there anything that we've learned about what works and what doesn't, and what could be implemented moving forward, specifically in Victoria?
Well, I think we've learnt a lot of things, but I don't think we've come to the conclusion about which of the measures is likely to give you the biggest bang for your buck. In particular, the particular example is masks. It's very difficult to unpack the effect of mandatory mask use, although undoubtedly there was an effect. So were the numbers to increase, certainly in states like New South Wales and Queensland, or anywhere around Australia, I think the threshold for implementing mandatory community masks is going to be a lot lower now as a result of the Victorian experience. But in terms of the staggering of restrictions, I think we understand that households are a major focus of infection, and as you've seen with the Victorian roadmap, and most other states and territories will put in restrictions on household numbers as one of the early interventions. So they're two examples of things that we've learnt. There are others. And I'll just go back very quickly to see if either Matt, do you have another question before we finish up?
No.
Dana, did you have another question? Dana might have hopped off the line. And Paul, did you want another question?
No, I'm fine, thanks.
Okay, good. Well, thank you very much, and we'll look forward to updating you later on in the week. Thank you.